Welcome to the award-winning Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our mission is to educate, advocate, and inspire women in healthcare to lift as they rise. Each episode brings you voices of leaders who are breaking barriers and leading the way in advancing women's health. Join our global community of listeners as we hear from her. Ready to be part of the movement? Let's dive in.
Well, hi, everyone, and welcome to this podcast. Today, we have two amazing guests who are changing how we understand sleep health. We've got Dr. Kimberly Sterling, a pharmacist turned health economist who now leads health research at a top sleep tech health company, and Dr. Audrey Wells, who's a triple board certified physician in sleep medicine, obesity medicine, and pediatrics. Between them, we're going to cover everything from cutting edge sleep apnea technology and hands-on patient care. So let's start with a stunning fact that I recently read. I read that about 32% of US adults, or about 80 million people, have obstructive sleep apnea or OSA. That's almost 1 in 3 adults, and most don't even know that they have it. These numbers are astounding. We're talking about an epidemic hiding in plain sight. We'll dig into why that is and how it affects women in particular and what can be done. But first, let's learn a little bit about our participants. Dr. Sterling, you've had a truly fascinating career path. From a pharmacist and health economist to vice president of health research at ResMed. That's a really big leap across pharma, medical devices, and now sleep technology. What sparked your interest in sleep medicine and OSA?
Such a great question. And thank you so much for having me on. I'm really looking forward to this conversation. As you mentioned, I am a pharmacist and health economist. I actually got into that based on pharmacy school and knowing I didn't want to do a traditional pharmacy role in retail or hospital. And so I knew that there was this power of using information to help patients get access to the medicines that they needed. And so I decided to do a master's fellowship through the University of Southern California, where I did a master's of pharmaceutical economics and health policy that allowed me to enter into the pharmaceutical industry, where I spent time in health economics and outcomes research. So, really looking at research, but more on the communication side and engaging with health systems and payers. And stayed at that particular pharmaceutical company for about 12 years, moved on to another one when I had an opportunity. And then I found myself in a unique position at that time of being laid off and saying, I've spent 16 and a half years in the pharmaceutical industry. Not that I was opposed to continuing that, but I was really looking for something new. And when ResMed came calling, I said, I don't know anything about ResMed or sleep, but I knew the hiring manager. I'm really intrigued with what you're trying to do to understand patient insights and impact to the healthcare system with data. And so I said yes to the opportunity. And so, as part of starting this new journey and having this opportunity to learn more about sleep health, I was really intrigued. And something we'll get into later is I ended up becoming a patient who has sleep apnea as well. And so that is also a very interesting perspective to be a researcher who's actually researching her own experience. So that's a little bit of how I came to sleep health. And it's been quite a fascinating 6 years that I've been in this space and have really enjoyed learning more.
That is quite the career trajectory. And, one of the things that we always enjoy hearing about on this podcast are the different career journeys that our women leaders go through to get to where they are now. So thank you for sharing that. So I'm assuming that you had connected with Dr. Wells through your time, obviously at ResMed. Tell me about how you guys met.
Yeah, we actually met at a very techie conference. So, not a medical conference where you would assume we would have met. But Dr. Wells had been interacting with one of our colleagues in our clinical engagement organization that's really trying to understand how to engage the medical perspective as well as the patient perspective, giving insights into ResMed, but also how do we work together. And so we met at the CES, the Consumer Electronics Show, last year and had a really good conversation around what we both see as opportunities, especially around women and sleep. And so I'm very excited that Dr. Wells has joined us for this conversation today.
Me too. I'm excited to have you both. And so, turning it over a little bit to Dr. Wells. Dr. Wells, you've spent 15 plus years treating sleep issues in adults. How did you end up specializing in sleep health? Was there something that inspired you? Take us through your journey.
Yeah, and I want to say too, like I'm so happy to be here today and be a part of this conversation, which I see to be in service of women who are listening and wondering if sleep health could be a factor in their own journeys, and hopefully some of the things we'll talk about today resonate with the listeners. I've come at sleep kind of in a tangential way. I was initially trained in pediatrics, and then I subspecialized in pediatric pulmonary medicine with an emphasis on lung transplant. And during my time in the ICU, taking care of kids who had had transplants, I started bumping up against the biological limit that I have for sleep disruption, or sleep deprivation, and it affected me in ways that were profound. Um, it really kind of highlighted for me the power of sleeping well versus not sleeping enough or sleeping poorly. And it affected my career trajectory such that I decided to make a leap over into sleep medicine, feeling like I would be in service to anyone who sleeps, which is everybody, right? I mean, that's something that has a lot of appeal for me. Um, I share with people sometimes that, my pediatrics training is definitely relevant because when we're sleep deprived, we all turn into frustrated toddlers who have a lot of, emotional lability or reactivity, kind of that hedonistic drive that underscores sleep as a fundamental biological need. So I've always felt really connected to the mission of sleep health, which is to be the baseline and the foundation for all other health aspects. I practiced in the Southwest for a number of years and then moved up here to Minnesota. I've been involved in bench research. I've been in leadership positions, and a few years ago, I decided to step outside the doors of my clinic and start a platform for sleep apnea education and support in a way that I had not seen in a clinical setting. So I very much consider myself somebody who is in service to the need that people have to sleep well and sleep better, and especially for women, I think that is a conversation that I love circling back to because women have such huge impacts on themselves and those around them. So, really happy to be part of this conversation today.
Absolutely. And that's an incredible career trajectory as well. And I think you hit on a very pivotal theme of what we want to discuss today, which is women and sleep apnea. Because historically, we always thought about OSA as an overweight, middle age guy problem, but we know now that that's not completely accurate. So, what are you both seeing in terms of women in OSA, in terms of diagnosis and management? Is it underdiagnosed, in your opinion?
What I can tell you straight away is that, you mentioned some really staggering numbers at the beginning, looking at between 1 in 3 to 1 in 5 people who have obstructive sleep apnea in the United States. but 90% of women are undiagnosed. I mean, it's really incredible. And as we learn more, what becomes clear is that the poster child symptoms of obstructive sleep apnea don't necessarily apply to women. I can speak to this personally and professionally because I also have obstructive sleep apnea. I knew it was coming because it's up and down my family tree. Um, but I have never snored to any particular extent, and my symptoms were rather subtle. I think if I wasn't in the field, it would be years, potentially even a decade or more, before I was diagnosed. But because I do take the time to walk a mile in my patient's shoes, and I've had many, many home sleep apnea tests, I started to see the pivot into abnormality and really connecting with the idea that women's symptoms are much more subtle, much more nonspecific compared to, like you said, the middle-aged man with the big belly and the big neck and snoring to peel the paint off the walls.
Right.
What's interesting about what Dr. Wells shared, I've always snored since I was little. And when I first started at ResMed, was going through training, we had a chance to take a home sleep test. And I'm like, this is going to come back positive. I did it twice. So 2 nights in a row, and I was normal. There was no symptoms. So that was 6 years ago. The difference, primarily about 6 years ago, now and then, is that I went into menopause. And so it was actually a conversation with my primary care physician who said, how are you sleeping? And I'm like, oh, I think fine. I am tired. And I was on some multiple projects at the time that really had me working long hours. And she said, I think you should take a home sleep test or you should take a sleep test. And I said, okay. And like Dr. Wells wanting to walk in a patient's shoes, I said, I want to see what the in lab sleep test experience was like. And when the results came back, I was like, I don't think it's right. I think this is someone else's from the lab because it scored high. Um, but what I will say is I never said I was sleepy because that's another common symptom that many people say, oh, if you're really sleepy, you fall asleep in the daytime, you probably have sleep apnea. Well, I never had that. I was just tired and fatigued, which I think more women express. And so one of the things I noticed after getting treated was actually I was no longer tired or exhausted to the extent that I was. And that was within a week's treatment. And I will say, from a research perspective, we started to look at the journey of patients from the time that they were diagnosed to the time that they actually got treatment and prior. And what we saw in our data is that a lot of the women who were diagnosed and then treated actually went through a pathway of depression and anxiety, insomnia before coming to a sleep apnea diagnosis. So this is all retrospective, which also tells you that the symptoms that patients or if women are talking about are different and it's taking them longer to get through that diagnostic pathway.
Absolutely. I think there's so many things that you both stated there, and that women present differently, and especially the two of you being in such busy and challenging careers, you could easily overlook those symptoms for just your lifestyle, right?
Mhm. Yeah, I think women tend to move toward over explaining based on the circumstances they're in. I'm stressed. I've got a lot going on. This will get better when. And because they're experiencing nonspecific symptoms or even self-describing as having insomnia, a little bit of self-diagnosing going on there, it can really sort of distract from the idea that you don't actually know at this point where what the blind spot is, or could you have undiagnosed, untreated sleep apnea.
Yeah, I think it's a great point. And I think with primary care and family physicians being on the front lines, there's not a lot of education within medical school, and Dr. Wells can talk to that. And so it's not the first thing that you think about, especially if you're thinking about the stereotypical sleep apnea patient. When your female patient comes in and they say, "Oh, I'm exhausted and I am in that sandwich generation. I have kids. I am taking care of my parents. I have, a job that has a lot of demands." Then you don't automatically think about sleep. You think about other things. And I do think that we need to continue to think about how do we improve screening tools as well as diagnostic tools that are not anchoring on symptoms that women may not express immediately.
I think, one of the things that Dr. Wells stated was women over explaining, but also there's the population of women in communities that don't traditionally discuss sleep or fatigue, where it's not as common. And so that's a barrier as well. And Dr. Sterling, you mentioned primary care being sort of the frontline providers who could screen for OSA. Sometimes they don't know the classical symptoms or the non-classical symptoms in this case that they should be looking out for, and some of the other comorbidities that women with potential sleep apnea experience. And so they're not always prompted to test their patients. So let's talk a little bit about the importance of testing and recognizing symptoms if we can. I imagine a lot of people, they probably hesitate to do a sleep study because they probably think that you have to go into a lab and go into a sleep study. And they probably think that they're, as Dr. Wells mentioned, symptoms are due to stress and that they're going to, pass. Uh, Take us through what a sleep study looks like. And more importantly, what is the benefit of getting tested for OSA?
I think that the testing is meant to shed light on a condition that otherwise operates under the cloak of darkness. And it's definitely a blind spot in one's health because just by being asleep, you are necessarily unconscious to your own symptoms. And sometimes people only experience the effects of their sleep disruption tangentially, how they feel the next day or how it is to wake up in the morning, sometimes in the middle of the night with prolonged awakenings. Not so common actually to like wake up gasping and choking for air, but that's certainly a big red flag. So I think there is a barrier when it comes to, what is the next step if I feel like a sleep evaluation may be beneficial to me. You mentioned the in lab sleep study, which traditionally was the way to get tested. But especially over the last handful of years, maybe even 10 years, home sleep apnea testing has created an option that's much more accessible, much more convenient, comfortable, and a lot a lot fewer sensors, which is always nice because that in and of itself can interfere with sleep. I will caution that there is a little bit of sacrifice of accuracy for convenience when it comes to home sleep apnea testing. So I really am reluctant to call a test negative. Um, when a person is symptomatic, I much prefer to say that it's inconclusive because it is only one night of data typically, and the test is certainly not perfect. But a home sleep apnea test is helpful and valuable if it's positive, and can also shed light on the severity of the condition that one is dealing with.
Right. Absolutely. And Dr. Sterling, it sounds like you had several tests actually that you needed to go through over a period of time to actually have your own personal diagnosis ascertained. So it does make sense to, like, as with anything else, as with any other condition, that we're kind of tracking that condition. It's not a one-time event. It's a kind of a life cycle. It's a lifespan. It's a journey.
Agreed, agreed. And I think it's interesting when Dr. Wells talked about the fact that we're unconscious when we're sleeping. If you have a bed partner, you're probably more likely to know whether or not you're having some of those pauses in breathing. And actually, I'm single. But I shared a room with one of my travel buddies. We travel the world. And this particular time, she woke me up and she said, "You stopped breathing." And I said, "What?" And this was like right before my physician had the conversation. So I do think that with more information, um, patients or persons before they become patients are going to be more likely to take some positive steps toward actually seeing what is actually happening. And I think with technology as well, there's starting to be some um, watches that actually have sleep detection, sleep apnea detection. It's not diagnostic. But with that information to say there's something going on, having that conversation then with your physician could become a little bit easier if you are prompted to have that conversation around how you're sleeping as well. So wanted to bring that out as yes, as our bodies change during different periods of our lives, we should be looking at not just the non-specific symptoms, but really saying what could be some of the causes of how our health is changing or not changing, as we get to some of the comorbidities that may be present or being exacerbated by not actually having sleep apnea identified and diagnosed.
Absolutely. You couldn't have said it better. I think as we age and as our bodies change, it's important to take ownership of our own health. And it sounds like for OSA, something that is so under recognized, it sounds like it needs to come from a couple of different directions. It needs to come from the patient being their own advocate, which is always important, but hard to do in this case when, the potential patient might not even think it's OSA, right? And then from the clinician perspective, how do we engage clinicians to think about this and some of those more non-traditional patient scenarios or encounters that they have?
Yeah, I want to be really transparent with my own experience. I mentioned that sleep apnea was strong in my family history, and I started seeing positive test results from home sleep apnea test kits come up in my 40s. And even with my background, I was very reluctant to receive this information. I thought it's too soon. This is not what I want. This test is wrong. And so those mental gymnastics are present no matter how much you know about a condition. And I I think that speaks to like the human striving for this. It just can't be me. Not yet, not now. I don't want it. Um as I went into menopause and started making that transition, I realized, "Oh my gosh, my whole face is falling down, so my airway must be falling down too." And sure enough, that's when the numbers started going up. And another sort of nuance started popping up, which was that I have the type of sleep apnea that happens to be much more common among women compared to men, which is REM related sleep apnea. So, this is sleep apnea that's more prominent during REM sleep or dream sleep. And the problem with diagnosing that is because only about 20-25% of the night is spent dreaming. If you have a high number of airway obstructions that are present during that minority part of the night, it gets diluted with all of the normal breathing you do for the rest of the night. And that contributes to a false negative home sleep apnea test, that contributes to false reassurance from your wearable device. And in a situation where you're personally reluctant to take in this information that you could have a sleep condition, I think it sort of feeds that, this is not for me, not right now. I wanna also name something that I see a lot from patients, which is that I don't even wanna test because I don't like my treatment options. And I think that this is changing for the better. This is something that I'm very excited to offer people. because there's tons of things on the treatment menu and within each item that make treatment personalization much more satisfying at this point. So, for anyone who's ever thought, I'm not even going to get tested because I don't want to get treated, so what's the point? I would encourage you to kind of mentally get past that hurdle and move forward with protecting your health.
Absolutely. Couldn't agree with you more. And I will say your patients, whoever they are, who are getting tested, are very lucky to have you as their clinician who's managing them, because not only are you able to diagnose OSA, but you're also able to diagnose at what stage of sleep it's happening. You know from your personal story and experience those nuances. And I hope that right now, with your treatment and your personal journey, you're having beautiful dreams. So let's talk about this. You brought up a really good point about stigma of treatment. So let's say you do a sleep study and you get diagnosed, whether you like it or not. For a lot of people, the next step is what's called a CPAP machine, right? Um, Tell us a little bit. What's the stigma behind the treatments? Is it the device? How do you address this with your patients? Are the devices now more convenient to use? Tell us a little bit about the treatment journey and how you talk to your patients about treatment and the importance of getting treated.
Yeah. Uh, First, I want to say that, a lot of people have some preconceived notions about what a CPAP machine is or what the mask is. They will make a motion with their hand over their face, kind of to indicate a full face mask, which goes over the nose and mouth. That's the biggest mask. And they kind of have their grandpa's CPAP machine in their mind, like this noisy, antiquated machine that takes up most of the bedside table. And I can tell you that the machines and the masks have gone through many iterations over the years, such that they are reliably quiet. That I much prefer recommending nasal masks, which are loads smaller than the big full face mask. And there's lots of comfort features available in the machines so that a person's breathing can feel more physiologic, and certainly a person can acclimate to PEP pressure better. It is the gold standard, and I find it useful to tell people why that is. The reason why is because it is non invasive. Um, 95% of the time, I can correct someone's sleep disordered breathing. This is a breathing disorder with PAP therapy, and it is multi level airway support. In other words, you're getting that air support in the nasal cavity, the air support behind the soft palate and the tongue, and even below the retro tongue space, so that that air stent is keeping the soft tissue airway open during sleep to eliminate snoring and promote normal oxygenation and better sleep quality. So that's why it's the gold standard. The pressure is customized too, so it's not really forcing air into your throat. It's actually just preventing that promoting that gentle air stent. And I think nowadays with remote delivery and all the comfort features available, people's experience is different compared to their grandpa's CPAP. Um, there there are other treatments as well, and I would just like to mention that I think layering treatments is more of an option now if somebody is not getting complete relief from just monotherapy.
Absolutely. And I think that I recently spoke with a friend actually last week, and I was telling her about this podcast, and she had shared with me that she also got diagnosed with OSA during menopause, and that she actually travels with her CPAP, but she takes it everywhere, that it's comfortable, that, it's quiet. Dr. Sterling, you also mentioned that it's quiet as well, that it's not loud, that it's something that's easy to basically, utilize when you travel even.
Absolutely. In fact, I have one of our newest generation devices. And the first time I put it on, I said, "Oh, wait, I didn't turn it on or I set this up incorrectly." But actually, the machine was on. So even from what I had tried 6 years ago in our training, it's even more improved from there. We also have a smaller Air Mini, a travel one. That's what I use. I travel quite a bit. Um, and so that is one that I can actually put into my carry-on.
That's amazing.
Yeah, it's great. And even with the normal size CPAP, they actually have travel cases. And so if you've ever paid attention, there's sometimes people who are boarding with 3 bags and not just 2. More than likely, it is a CPAP travel case. And because it's a medical device, that can be separate. So there's the convenience there as well.
I do remember a few months ago, I was traveling with my family for a family vacation, and there was a call made from the security check-in checkpoint, and it was somebody that forgot their CPAP machine. And I'd never seen someone run through the airport faster to kind of try and get her. It was a lady. She looked at me, and I looked at her, and I said, "I think they have your CPAP over there." And she just ran to get it. So obviously that sort of hinted to me like how important it is when you're getting treated. So it really sounds like, once you're over that initial shock of diagnosis and actually explaining what this is, and then explaining how the treatments work and that they're actually beneficial and that you not only feel better in your day to day, but that you're really kind of preventing some other risks and some comorbidities from being exacerbated is what could potentially help to convince someone that has this of the benefits of getting treatment, right? So, if we can quickly just pivot to a little bit about health improvement and comorbidities, right? There are risks of untreated OSA. And I wanted to dive a little bit deeper into that, right? It's not just making you tired, but it can be really dangerous for, long-term health. Is that right?
Yeah, that's exactly right. When I talk to people about what could happen if you don't choose to treat your sleep apnea, I mainly focus on issues related to brain health, i.e., insulating yourself from dementia risk or memory problems, heart health, which is the number one killer in the United States, especially for women, and metabolic health. So these are kind of the physical body manifestations that start to erode when you are having untreated sleep apnea, which again is a breathing disorder. On a day to day basis, I think really looking at one's mental health is important because, women who have an untreated um, sleep related breathing disorder don't really feel like themselves. And when you struggle with memory or productivity or mood, it's kind of really disconcerting, and you start getting further and further from the person that you want to be. We mentioned menopause a couple of times, and I consider myself a women's health advocate, particularly in midlife. Part of that is because that's where I find myself these days. But there's a lot of mental health issues that come up around that midlife transition. And com- sort of coincidentally, and maybe there's some causation there for a lot of women too, that's when your sleep apnea risk goes up and actually becomes equivalent to that of men. So that midlife transition is very vulnerable and fraught with mental health issues that can not only affect your daytime functioning, but also your ability to sleep at night as well.
Absolutely. And I'm so glad that we're actually sharing those insights on this podcast because this is exactly what this series was meant to do was, to increase awareness about conditions that disproportionately affect women and also the time frames at which they do affect women. And menopause now is becoming a huge part of the discussion. obviously, women's health is becoming more prominent, and I think this is definitely something that we really want to highlight as an organization is to pay more attention to those symptoms in women and for clinicians as well as patients to know how to advocate for themselves. So, turning it over to Dr. Sterling a little bit, from your standpoint, what do you feel like are some additional things that we should be doing to increase awareness about OSA, especially in women?
I think starting with conversations like this is very important. I think also increasing the awareness among healthcare professionals to have that conversation to dig a little deeper when you do see non traditional sleep apnea patients presenting in front of you with uh, tiredness, fatigue, sleepiness, or even just not feeling themselves to dig a little deeper and maybe considering sleep. I think there's also this importance of understanding that sleep is just as important to your physical health as we always talk about exercise and diet pretty often. We've talked about mental health on this, which we've seen improvements in mental health and some of those outcomes with treatment of sleep apnea. There's been some recent research that ResMed has been involved in that has shown reductions in mortality. If you're thinking about all cause or from any cause, our study showed that there was a 37% lower risk of mortality being treated with CPAP versus not being treated for those who had sleep apnea. And then Dr. Wells talked about cardiovascular system as we think about heart attacks being something that women atypically also present, as we've come to know over time. And in our study, we saw a 55% lower risk of mortality from cardiovascular disease. So again, as we think about how to get over some of the hesitancy with treatment, because I too was like, this test cannot be right because I don't want to be treated. But what changed it was I knew too much not to start treatment. And I think the other thing was I was being very observant of what changed in my life after starting therapy. And what I noticed within a week's time of being on CPAP, I was drinking less coffee to get through the day. And I had more of that energy and kind of thinking about what was my former self, having more energy, not being as exhausted, and then beginning to say, okay, this is actually something that's really good. And the reason maybe why the lady was running through the airport, besides not wanting to miss her flight to go back to get her machine, is that you do function better. When I travel, I always take my CPAP with me because I find my cognitive clarity is better. It's subjective. It may not. I have not taken a cognitive test to say before and after. Here are the results, but I do perform much better when I've been on therapy versus taking a mini break because I am sometimes a regular person who is not as compliant as I probably should be. So those are the things that we should really think about from an education standpoint of not only think about sleep apnea and sleep health as being very important and trying to identify patients who may have this as a disease, but also beginning to think about why it's important to treat and to improve your health. We're also starting to see that some studies are showing that with untreated sleep apnea, you may actually have uncontrolled hypertension. So, as we're trying to chase lowering our blood pressure readings with treatment, could sleep apnea be contributing to that? So, there's so many interlinking rather than looking at systems in isolation, really thinking about how they do intersect and sleep being very important. And I know we've talked a lot about sleep apnea today, but sleep health in general and destigmatizing that we have to be super women and get only 5 hours of sleep. And that's a badge of honor. Really, I'm telling all my friends, like, my badge of honor is when I've had 7 to 8 hours of sleep. Like, I am my best self.
Absolutely. I mean, honestly, again, you couldn't have said it better. I think sleep health is hugely important. And I think that This has been an awesome deep dive. So I just really want to take the opportunity to thank you both. And before we finish, I wanted to give you the floor for another moment. What should women, everybody actually, but especially women listening to this, what should they take away from your personal journeys and what we've discussed today? If there's one thing for people to take away, what do you guys think it should be?
I would say that it's worthwhile to have a low threshold to consider sleep, a sleep disorder as contributing to your long-term health, just because we spend a quarter to a third of our lives sleeping, and until you look, you don't actually know. And it's not about how loud you snore. It's not about how much weight you have on your body. It's not about, what your brother or parent or neighbor has done or not done. It's about you and you advocating for your own health and well-being.
Absolutely. Dr. Sterling?
Think of sleep as being vital to your health. And whether it is with a sleep breathing disorder or not, how are you thinking about optimizing your well being by considering sleep health as one of those vital signs that you want to pay attention to? Whether that is educating yourself, um, getting treated if you do suspect or have in the past been diagnosed, or even passing on the information to others. That is one of the best ways to be in service of others. I loved how Dr. Wells started the podcast off talking about being in service of others. Passing on that information becomes really important as well.
Absolutely. And so thank you so much, Dr. Sterling and Dr. Wells, not only for sharing your expertise in this area, but your personal story. This has been eye-opening, the unique challenges that women face, to the way that we should get tested and treated. I think the takeaway here today is clear. Don't ignore your sleep. And if you're there and you're constantly tired or you suspect something's off, be your own advocate. It could literally change your life. Thanks for listening. And until next time, everyone, sleep well.
To our listeners around the world, thanks for joining us today. Tune in as we continue our journey to amplify the voices of women leaders in healthcare. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next time, remember to lift as you rise.